So joint replacement or joint reconstruction is an operation for patients who have problem with the articular cartilage of their joint. And when the articular cartilage wears out, the underneath bone gets exposed, and the bone touching on bone causes some pain. And because of that, the options available is either to reconstruct or reorient the joint, so-called joint preservation, or replace the joint, which is joint replacement. So any of those operations are intended to remove the area of bone that's exposed, that's causing symptoms for the patient. So when we decide to do a joint replacement for a patient, at Acıbadem we have a fantastic system, it's called EOS, that gives us the opportunity to do the x-ray of the spine, hip, pelvis, everything together. That tells us an idea, gives us an idea about the alignment of the joint. Also, using the same system, we can measure the size of different parts of the joint that's affected. So that's called preoperative templating. And then during the surgery, we usually rely on that templating, put temporary parts in to make sure they fit. And if they fit, we change those temporary parts to permanent. And then some of the surgeons at IJC are using robotics and precision surgery. So that also helps, because prior to surgery, we're doing a CT scan of the joint, which helps us measure the joint sizes and have the right prosthesis available.